Thanks, Jody. Of course Linda will hit it in 2008. We all know that. It's great to see you. And I'm happy to be here and following our President, Andy Stern, who I understand some of you heard from earlier this morning, and Dennis Rivera, whose photo you see in your material. I tried to do a little costume this morning, and it didn't work out, so I thought I'd just come au natural. He sends his greetings. He is the chair of SEIU Healthcare and joins me in representing the million healthcare workers that we represent across the U.S., Canada, and Puerto Rico. And Andy's asked him since the middle of last year to focus his effort on building the campaign for national healthcare reform inside of our union and with all of the partnerships that we're working with, like you today. So he sends his greeting. I also wanted to thank Charlie Cobb of CED and Len Nichols of the New America Foundation for joining today with Better Healthcare Together to highlight an important new report from McKinsey. We all know that our healthcare system costs too much, leaves too many out, fails to deliver consistently, and fails to reward prevention. We also know that time is running out, and it is time now for action. The forecasts from the Congressional Budget Office tell us that if we don't find ways to bend the curve and slow the rate of growth in healthcare spending soon, healthcare will grow from 16% of our economy today to 25% of our economy by 2025. I always think to myself when I hear those numbers, you know, we've heard them, we've heard them, we've heard them. And I don't know about you, but sometimes I get numb to those numbers, but it is kind of our moment to deal with that incredible statistic. And as a union of healthcare givers and caregivers across public services and in property services, SEIU has a strong sense of urgency about our responsibility to be part of this solution. The unnecessary waste, the stark inequities, and the lack of demonstrated value documented in the McKinsey report and other reports have become intolerable for our members, for non-union workers, and for all of our families. American voters have given us a rare opportunity to fix this enormous problem. The severe economic recession demands that we make public investments now to put in place building blocks for a more efficient and patient-oriented healthcare system that can cover everybody. But opportunities like this one have been squandered before. We wouldn't want a show of hands in this room about the moments that we've had in our generation. So we've asked ourselves, how do we avoid making the same mistakes that we've made in the past when we've tried to enact comprehensive healthcare reform legislation? We've asked the question of ourselves. We've asked the question of wise men and women of the U.S. Congress who have tried and failed before. And we've asked the question of our employers, physicians, hospital leaders, insurance and drug company CEOs who recognize that their business models are not viable in the long run without comprehensive reform. First, those of us in the labor movement must reach out to workers and families everywhere and listen to their hopes and fears. We are building lists of millions of healthcare voters together with organizations such as AARP, the American Cancer Society, Cancer Action Network, and the faith community. We are asking people from all walks of life to get engaged in this national conversation to fix healthcare. We are reminding them that the status quo condemns us to greater economic insecurity, to continued stagnation of wages, and to confusion about what actually works and what we most need to do to stay healthy or to treat our diseases. We are asking them to accept no excuses from their members of Congress for not passing a healthcare reform bill this year. Second, congressional leaders must put aside differences, put aside egos, and avoid distractions and turf battles, and unite around a common approach and even a single bill. They must resist the impulse to legislate every detail and delegate some decisions to other entities. Third, we need a public-spirited business leadership who put their leadership on the line for this issue. There will be trade deals and tax bills and industry-specific issues that will also rightfully claim the attention of business and industry. That is why Better Healthcare Together and companies who have united in this effort are so important to the ultimate success of healthcare reform. The voice of individual companies who are willing to put their brand out there on behalf of a better healthcare system that covers everybody and drives greater value is a voice that can make an enormous contribution and make an incredibly decisive difference to winning this year. We appreciate that the private sector is often skeptical of the public sector. But if the events of the last year have taught us anything, they have taught us that the private and public sector must work together, and that thoughtful public policies and programs can make markets work better. That is our challenge in healthcare, and it is a challenge we can only meet together. I look forward to hearing from our distinguished panelists about their analysis and recommendations for us. Thank you. And Linda, take it away, girl.